Dr. James McCune Smith was an African-American physician, pharmacist, abolitionist, and author. He was the first African-American to earn a medical degree. He earned his bachelor's, master's, and medical degrees at the University of Glasgow, in Glasgow, Scotland. He was also the first African-American to run a pharmacy in the United States. After completing medical school and a residency in Europe, Dr. Smith returned to New York with a mission to help people, especially less fortunate African Americans. He started a clinic for white and black patients in Lower Manhattan. His clinic also provided a place where many escaped slaves found help. Dr. Smith also worked as the physician for the Colored Orphan Asylum in Manhattan for 20 years. Despite his successful medical practice, he was never admitted to the American Medical Association or local medical associations. Most likely due to the systemic racism Dr. Smith confronted throughout his medical career. Dr. Smith has been well known for his leadership in the abolitionist movement. Counted amongst his friends and colleagues were several leading abolitionists, including Frederick Douglass and John Brown. In collaboration with Frederick Douglass, Dr. Smith helped start the National Council of Colored People in 1853, the first permanent national organization for blacks. Douglass called Dr. Smith the single most important influence on his life. Dr. Smith lectured on race and abolitionism, and wrote numerous articles to refute racist ideologies that purported inferiority of black people. Dr. Smith was one of the Committee of 13 who organized in Manhattan to aid refugee slaves via the Underground Railroad, thereby resisting the newly passed fugitive slave law. James McCune Smith was born into slavery in 1813 in Manhattan and was set free on July 4, 1827, at the age of 14 by the Emancipation Act of New York. His mother was an enslaved woman named Lavinia. His father was Samuel Smith, a white merchant and his mother's slave master. James McCune Smith grew up only with his mother. James McCune Smith's mother also achieved her emancipation from slavery while living in New York. Upon his graduation from the African Free School in Manhattan, he applied to Columbia University and Geneva Medical College in New York State, but was denied admission due to racial discrimination. Abolitionist benefactors of the African Free School provided money for Smith's overseas trip and education. In the early 1840s, Smith married Malvina Barnett, a free woman of color who had graduated from the Rutgers Female Institute. The couple had 11 children. 5 survived to adulthood. By 1860, Dr. Smith was wealthy and had built and lived in a mansion. However, in 1863, after the burning of the orphanage in which he practiced medicine for over 20 years in Manhattan, and the draft riots in Manhattan that took the lives of over 100 black people, Smith and his family were among other prominent African Americans who left Manhattan and moved to Brooklyn for safety. His children married white spouses and passed into white society to escape racial discrimination. In 1847, the New York Academy of Medicine was founded, and Smith was nominated for fellowship. But because of his race, Dr. Smith's nomination was effectively rejected. In November 2018, 171 years after his nomination, the New York Academy of Medicine posthumously inducted Dr. Smith as a fellow into the Academy. Dr. Smith, in 1863, was appointed as professor of anthropology at Wilberforce College, the first African-American-owned and operated college in the United States. Dr. Smith was too ill to take the position. He died on November 17, 1865, at the age of 52, from congestive heart failure. He was survived by his widow Malvina and their 5 children.